Hey guys, this is my clinical video for Nursing 3. All the information here is pretty much taken out of the Saunders-Silvestri 6th edition. I'm just going to go over some basic developmental growth stages and what to expect as far as growth is concerned for the different age groups, along with vital signs, the normal values for each age group. Basically, chapter 23 in the Saunders-Silvestri book starts off talking about guidelines for communicating with pediatric patients. Some of them are listed here. You want to establish a comfortable relationship with the pediatric patient. You can communicate with them through the use of objects or diagrams or pictures or whatnot. And you definitely want to allow the child the freedom to express any fears, questions, or concerns. You'll want to speak clearly and not feel like you're trying to rush communication with the children, because they can really pick up on that. You'll want to be honest with them. So if you're going to give them a bunch of shots, you definitely don't want to tell them it's not going to hurt if it's going to hurt, because then they won't trust you ever again. And if you work in a clinical office and you see that child repeatedly, they're going to, just be more mortified every time they see you if you lie to them. You also want to set limits with the child appropriately. Some of them can act out. I mean, you never know what type of upbringing they have. They may say stuff that's inappropriate. One of the things that you want to try to do is to not react to anything that may be inappropriate. And also remember that small children, they accept explanations in a very literal manner. So you want to try to mimic the way that they talk to you, using really simple language, simple words. You'll want to use short, concrete terms and try to avoid the technical jargon. Just use really simple language with them. One thing that you can also do with all the different types of equipment that we have in the hospitals and in the clinical setting, you'll want to allow the pediatric patient to, look at them, touch them, hold them, demonstrate them. Maybe you can role play and demonstrate on a stuffed animal or something so that they can feel the objects and know that it's not going to hurt them, so that you can get your concrete diagnostic data that you need. Okay, so some of the developmental stuff by age group. First, we'll start off with the infants. Their height, they're going to gain 1 inch per month in the first 6 months, and then by 1 year of age, their length will have increased by 50%. With their weight, it's doubled at 5 to 6 months and tripled at 12 months. As far as head circumference goes, their head circumference at birth is normally 33 to 35 centimeters, which is approximately 2 to 3 centimeters more than their chest circumference. And then by age 1 to 2 years, by 1 to 2 years of age, their head and chest circumference are equal. Okay, now as far as fontanelle closure goes in the infants, the anterior fontanelle is going to close between 12 and 18 months of age, and the posterior fontanelle will close by the end of the second month. So when they're 2 months old, right around 2 months, it should be closed by then. Characteristics of a normal fontanelle, it should be soft and flat. And that indicates normal. If you feel the fontanelle and it's kind of sunken in, or it's bulging, you definitely need to know that that's not a normal sign, and they're either dehydrated or overhydrated at that point. This is a quick little snapshot of the top of an infant's head, and it shows the anterior and the posterior fontanelle. You have the diamond-shaped anterior fontanelle towards the top of the head, and then the posterior is in the back. Going on to developmental characteristics by age group, we have toddlers. Their physical height and weight increase in phases. So that just means that they have like growth spurts and lags. Their head circumference should increase about an inch between ages 1 and 2. Their weight gain is slower than it was in infancy, so it kind of slows down the older that they get. By age 2, their average weight is 22 to 27 pounds, and their height changes will include growth of about 3 inches per year. So the average height of the toddler is about 34 inches at 2 years old. Another characteristics of a toddler is they're going to have like a pot belly. It's going to be very noticeable. That's because they have weak back muscles and weak muscles in general. So their belly's going to stick out like a big old pot belly, and call that lordosis. As far as developmental characteristics for preschool age kids, the preschooler grows about 2.5 to 3 inches per year. Their average height is 37 inches at age 3, around 40 for age 4, and 43 inches at age 5. As you can see, their growth and their height kind of slows down the older that they get. As far as school age kids, girls are going to grow a lot faster than boys. Their growth in height is about 2 inches per year between the ages of 6 and 12. And school age children gain weight at a rate of about 4.5 to 6.5 pounds per year. Adolescents, this is the time when their physical characteristics are going to change due to puberty. They're going to develop, their hormonal functions and growth spurts and secondary sex characteristics. Their body mass increases to an adult size. The sebaceous and sweat glands become active and fully functional. Body hair distribution occurs. And for girls, menstrual periods occur about 2.5 years after the onset of puberty. In boys, they'll have increases in height, weight, muscle mass, penis and testicle size occur, like they're going to grow due to puberty. And also their voice is going to change. It's going to get a lot deeper during puberty. There's a wide range of normal vital signs, starting with newborn all the way to adolescent. So I'm just going to kind of go over these. Temperature, heart rate, respirations, and blood pressure. They're all different for each age group. As far as temperature for a newborn, normal temperature is 96.8 to 99. And you're going to take their temperature in their axillary, making sure that you're putting the temperature probe in the middle, touching the skin in their axillary region of their armpit. Their apical heart rate, normal is 120 to 160. Their respirations are 30 to 60. And a normal blood pressure in a newborn is 80 to 90 systolic and 40 to 50 diastolic. Vital signs for a 1-year-old, your axillary temperature, again, you're going to take it under the arm. Normal temperature is 97 to 99. Their apical heart rate is 90 to 130. Their respirations are 20 to 40 breaths per minute. And their blood pressure should be 90 diastolic and 90 systolic and 56 diastolic. Toddlers' vital signs, their temperature range is from 97.5 to 98.6. Their apical heart rate is 80 to 120. Respirations are 20 to 30. And blood pressure is 92/55. The preschooler, again, you're taking their temperature in the axillary. 97.5 to 98.6 is considered normal. Apical heart rate is 70 to 110. Respirations 16 to 22 breaths per minute. And their blood pressure should be 95 systolic, 57 diastolic for a normal range. School-age children, their temperature, you can start taking it orally. So you just place it in the proper placement under the tongue. 97.5 to 98.6. Apical heart rate is 60 to 100 beats per minute. Respirations 18 to 20 breaths per minute. And their blood pressure is going to go up a little bit. So you're going to see, on average, a normal blood pressure for a school-age child, 107/64. This is just a chart giving you a breakdown and showing you the different changes from newborn to adolescent. So you can see the respirations are going to be slowed down the older that they get, and they breathe a lot faster and more shallow the younger that they are. This is something I'm sure we're going to be seeing on questions on the NCLEX. They're going to want to make sure probably that you know how to find different landmarks for your heart sounds. So I wanted to make sure to include this in here for your knowledge as well as mine. You have your aortic, pulmonic, Erb's point, tricuspid, mitral, and apex. And one way that I try to remember all of them is by saying all people enjoy them all. So you have the APETM. Aortic, pulmonic, Erb's point, tricuspid, and mitral. I hope you enjoy my video. I'm not a professional by any means, so I want to thank you for being patient with me.